second one would be that the doctor, once they reach the age of 70, has a general health check with their own GP or another doctor if they prefer, and the results of that are kept confidential between the doctor and the GP, and the board only needs to know about what happens if the doctor has a really serious condition that is impairing their ability to practice safely, and they're not willing to do what's necessary to fix that. So the very, very vast majority of doctors' health information would be confidential between them and their GP, but we would just know that they had had the health check done.
That was Dr. Anne Tonkin, the chair of the Medical Board of Australia. I'm going to go down to Michael Page. He's the WA president of the Australian Medical Association. Good afternoon, Michael.
Good afternoon, Jo.
What's your response to this? You're a young doctor. You're a fair way off 70. What do you make of what the Medical Board's proposing?
Well, look, thank you for that compliment, firstly, Jo. Look, I think as anyone, yes, I'm relatively young. I'm in my early 40s. But anyone, from the age of about 25, our mental and physical performance can start to decline. So we all recognise that age is associated with decreased performance. But of course, there are many, many doctors and other professionals, leaders, world leaders, business leaders in their 70s, 80s, and even older, who are operating at a very high level, and others are not. And on the other hand, people can experience illnesses that reduce their mental or physical performance at a much younger age than 70 as well. So there is some nuance required here, I think, and I think the Medical Board just needs to be very cautious that it doesn't put in place any policies or procedures that are seen as ageist, because of course we don't want to make presumptions that just because a doctor is older that they're no longer able to perform at a high level.
And there's sort of the counter-argument, which is with age comes wisdom. I mean, I'm really comfortable seeing an older doctor because they have seen so much more, and potentially, those years of experience make them a better doctor.
That's absolutely true, Jo. That's true for patients, and it's also true for the junior doctors and medical students training under those older doctors, that they get to learn from those decades of experience from people who've seen it all and have that historical context. So it is important that we keep a bit of age and wisdom in our medical system for that reason.
What about the point about patient safety that Dr. Anne Tonkin was making?
Look, I think the Medical Board of Australia has referred to data indicating that doctors over 70 are more likely to be subject to complaints than younger doctors from patients. But, the devil's always in the details. We need to understand what those complaints look like, what they relate to. Are they substantiated? A complaint is not necessarily an adverse finding until a process has been completed of investigation. So it would be very useful for us to understand exactly why or exactly the nature of that discrepancy.
Have you spoken to any of your members? Have you had any sort of feedback from doctors out there about this?
Yeah, we've had a lot of discussion with our members today since this announcement, and the views are fairly consistent that, look, I think a non-onerous process of having what sounds like a fairly standard medical assessment every few years after the age of 70 is not in itself likely to cause a huge amount of offence to doctors. Will it achieve the aim that the Medical Board wants it to achieve? I don't know. Will it be seen as a condition being imposed on people when younger doctors who might be impaired don't have the same imposition put on them? Will it be seen therefore as discriminatory? That sort of remains to be seen. But I think in general the response has been not one of outrage, but one of, look, let's just make sure they get this right so that it's not discriminatory, so we don't throw the baby out with the bathwater.
Do you know how many doctors practicing in WA are over 60?
Look, I don't have those statistics.
Because we have got a massive skill shortage, so it would also be a bit of a disaster if we lost doctors.
Yeah, in some specialties, the average age is quite high. It's sort of 50s, 60s. So there would be many doctors in many specialties who are in those older age categories. And you're absolutely right. We do have a medical workforce crisis at the moment. So to push people out of the system would be a disaster. But I don't think what the medical board is proposing is pushing people out of the system, but if people perceive it as a sort of slight on their abilities and decide that the requirements just make it not worth it for them, then of course we could see people leaving the profession earlier than they might otherwise.
Good to talk to you, Michael. Thanks for your time this afternoon. That was the AMA WA President, Michael Page. The medical watchdog, the Medical Board of Australia, is proposing health checks for doctors over 70. What do you make of it?